Well, hello everybody. My name is Dr. Albert Ahn, and I am very privileged to be the moderator for today's presentation, which is titled Feline Coronavirus and FIP Diagnosis and Prevention by Dr. Diane Addie. Dr. Addie is a veterinary virologist whose PhD and main focus of research is on feline coronavirus and feline infectious peritonitis. She is a former senior lecturer and head of diagnostic virology at the University of Glasgow Veterinary School and a member of the European Advisory Board of Cat Disease. She is also the author of www.catvirus.com website and has channels on YouTube and BitChute. Her dream is to eradicate feline coronavirus and therefore FIP. Without further ado, I'd like to have Dr. Addie please start her lecture. Dr. Addie?
Thank you very much, Albert. Thank you, ladies and gentlemen, for coming along today and giving up an hour of your time to talk about this. Here is a word that you're probably all incredibly sick of hearing: coronavirus. People wonder, why is it called coronavirus and why is the beer called Corona beer? Is the virus perhaps called coronavirus because the nice little spikes that we see on the electron micrograph on the right look like a crown? I would like to ask you to do the poll question just now to find out who is here for feline infectious peritonitis, who is here for SARS-CoV-2, who is here to hear about both or for other reasons. Once a cat becomes infected with feline coronavirus, most cats are asymptomatic or show a little bit of diarrhea, although some cats can develop quite severe diarrhea. So most cats become transiently infected, shedding virus, type 1 virus, for just a matter of weeks to months. But a small percentage, about 13%, becomes persistently infected without developing FIP. In this way, feline coronavirus and SARS-CoV-2 are similar. The majority of infections are mild or completely subclinical. Feline coronavirus shedding is detected by reverse transcriptase polymerase chain reaction, RT-PCR, of the feces. Seroconversion to feline coronavirus occurs 18 to 21 days post-infection. The second possible sequelum to coronavirus infection of the cat is feline infectious peritonitis. Feline infectious peritonitis occurs in up to 10% of infected cats. Severe acute respiratory syndrome, SARS, according to the Worldometer's figures as of today, occur in only 2% of SARS-CoV-2 infected people. The previous, the closed cases, it's 13% of coronavirus infected people. We see a seasonality in both human and feline coronavirus infections in that both are worse in the winter months, and nobody really knows why. Feline infectious peritonitis is where we tend to step in, but bearing in mind that the majority of cats do not develop FIP. But FIP is obviously the manifestation that grabs our attention. Professor Mike Willard once said, "A wrong diagnosis can be far more devastating than no diagnosis," and he was absolutely right in that. I hope to shortly produce a video entitled something like, "Why did these cats diagnosed with FIP not need GS441524, which is the nucleoside analog that Professor Peterson published last year as being curative for FIP?" And the answer is because the cats that I just showed you did not have FIP, they had some other condition. 40% of cats that come to my referral practice from referral practices as diagnosed with FIP turn out not to have FIP, and 80% of cats that have just gone to a primary practice with diagnosed as having non-effusive FIP turn out to have some other condition. Well, what are these other conditions, you're probably wondering? Many of them are toxoplasmosis or tumor, and also we see a number who are misdiagnosed having really got bacterial pleurisy or peritonitis. The clinical signs are very varied, involving ataxia, uveitis, weight loss, failure to gain weight, pleural effusion, abdominal effusion. There's a huge variety of presenting signs, which is what makes diagnosing FIP so very difficult. Doctors are also recording that SARS-CoV-2 is presenting in a number of ways. We haven't got time to go into the pathogenesis of feline infectious peritonitis, but it involves an immune-mediated reaction and the perigranulomatous pyovasculitis, which is why it can present in so many ways. The outcome for the cats that you saw are that they mostly recovered when put onto the correct treatment, or that they are in remission. Well, you're probably thinking, how on earth did these vets manage to misdiagnose these other cases as FIP? And rather shamefully, in some cases, it was simply on raised globulins. Well, you all know that globulins will rise in any infection, bacterial or viral. So that's a very non-specific sign which should not be misdiagnosed as FIP. And in a number of other cases, FIP was diagnosed as simply because the cats were seropositive for coronavirus antibodies. If you only remember one message from today, let it be that a positive feline coronavirus antibody test is not diagnostic of FIP. We already saw at the outset that the majority of cats infected with coronavirus don't develop FIP. So how would you confirm that a cat has FIP? In effusive FIP, you would send the effusion for RT-PCR testing, and if it's positive, that's 96% specific for FIP. And for non-effusive or dry FIP, you would send a mesenteric lymph node fine needle aspirate for RT-PCR, and again, the specificity is 96%. Even if a laboratory asks you to send blood for RT-PCR, do not do so. The laboratory is mistaken. Blood can be positive on a cat that's just in early viremia, so about 5% of positives will be false positive. But the main problem is that the vast majority of cats with FIP will be negative for virus RNA in their blood. Ruling out FIP diagnosis is relatively simple. In both cases, a negative coronavirus antibody test will rule out the diagnosis of FIP, provided it's sensitive enough. And here is the opposite message, that you should always do a coronavirus antibody test on blood, not on an effusion, especially if you're using a lateral flow or rapid immunomigration in-house test. To take you back briefly to undergraduate level interpretation of FIP and coronavirus tests, or indeed any tests, sensitivity is the ability to detect a small amount of something. Specificity is the ability of that test to detect whatever it is correctly. For ruling out an FIP diagnosis, or for doing screening tests, you want a sensitive test because you do not want false negative results. A few years ago, I did a test comparison of feline coronavirus antibody tests, and we published it in the Journal of Feline Medicine and Surgery. It was part of my drive to eradicate feline coronavirus. And for that, I knew that people needed access to a sensitive and accurate feline coronavirus antibody test. I invited a number of laboratories and manufacturers of test kits to take part. And some of them replied. I gave people the option to not have their tests published if they wanted, I would simply give the results to them, to the manufacturers. So here, what you see really are the best of the best. You might be wondering why IDEX isn't a part of it, and they were invited, but they told me that they didn't have a feline coronavirus antibody test at that time. What you can see here is that 2 of the tests did exceptionally well, and one of them was the feline coronavirus immunocomb ELISA test from Biogal. And this is the test here. I like this test because it's anybody can use it. You just store it in the fridge. But if you can see the little capillaries here on the left, I would advise you, if you're using a lot of these tests, to treat yourself to a proper laboratory pipette and tips, so that you can more quickly and very accurately measure 5 microliters of your sample to put into the little wells in the comb. This case here I want to tell you about. This case was actually diagnosed as FIP, pyogranuloma of the brain, at a university vet school clinic on the basis of the coronavirus antibodies, which turned out to be a false positive. And we asked the laboratory concerned to check this sample because it seemed incredibly unlikely, due to the cat's history, that the cat would have coronavirus antibodies. So this emphasizes that specificity of the test is also important, along with sensitivity. You can download a feline infectious peritonitis diagnosis flowchart from the catvirus.com website. You go to the downloads page, the free downloads, and find it there. Now, the guardians of this cat with the brain tumor had done that, and they had answered step 1 of the diagnosis algorithm and worked out that it seemed incredibly unlikely that their cat really would have FIP. When you do the downloads, you will get this download for diagnosing wet FIP, this one for diagnosing dry FIP, this one for diagnosing coronavirus enteritis, which is a diagnosis of exclusion because there are so many causes of diarrhea in the cat, obviously. And this same flowchart for interpreting RT-PCR tests and coronavirus antibody tests. We don't have time to go into these charts in details, but if you subscribe to my YouTube channels, you will see the workings out of these algorithms with particular cases. Does Pancho have FIP? Does Tommy have FIP? And there will be more of these series being released. The links to those are in your notes. So this cat with the brain tumor was a 13-year-old cat who had been a street cat, i.e. a stray cat, who was rescued and brought in by some kindly people, and he lived alone with them. So importantly, there was no opportunity to get infected with FIP. And one of the things people are tempted to miss when they look at these algorithms is the history. And it's really important to find out, has the cat had an opportunity to become infected, usually within the last 2 years, fairly recently. And also we look for stress. Was the cat stressed recently? The incubation for effusive FIP is just weeks post-infection, usually, not always. It can also occur a stress happening, such as a booster vaccination. So importantly, has the cat had an opportunity to become infected with coronavirus? Because if not, the cat cannot have FIP. This shows you a survival curve from my studies, my PhD studies. And on the y-axis, that is the vertical axis on the left, you can see the mortality at each time point, the time point being along the x-axis in months. And below the x-axis, you can see the number of cats at each time point. The steps down on the survival curve indicate deaths to FIP, Therefore, you can see that it was most steep, that the curve was most steep during the first 18 months post-infection. In other words, cats were most likely to develop FIP within the first 18 months post-infection. Going out to 3 years, if a cat was 3 years post-infection, the chance of developing FIP was less than 5%. Now, I'd like to put you all to the test. I'm going to launch a poll question in a moment. Based on this cat, this was a real case in Australia, and the people contacted me the day before Misha was due to be put to sleep with FIP. Well, that's for you to decide. The history is that the cat was 6 years old, indoor only, in a 2-cat household, and the other cat was obtained 3 years previously. The cat presented with behavioral changes, anorexia, ataxia, a head tilt, weight loss, temperature of 38.9, so slightly but not hugely raised, and vision loss. Laboratory results included a coronavirus antibody titer of 640, which is mildly elevated, an alpha-1 acid-glycoprotein of 1650 micrograms per mil, which is elevated, but alpha-1 acid-glycoprotein is an acute phase protein, so arises with all infections and is most useful in differentiating FIP from non-infectious conditions such as tumors or diabetes, and the albumin to globulin ratio was 0.45. So my question to you is, would you put Mishka to sleep? Your choices are yes, no, probably, or no, or you don't know. We've got a very bright audience today, haven't we? They wouldn't put Misha to sleep. That's great news. I was just saying that she's clearly a pedigree cat. So she received a myringotomy under general anesthetic and antibiotics, and she made a very good recovery. She never totally recovered from her head tilt. She always had a bit of a head tilt, but at least she was still alive. So her diagnosis, in fact, was inner and middle ear infection. We are going to the questions for 5 minutes.
To try to plow through as many of these questions, and those that we can't get to right now, we will take at the end. So, Diane, the first question is from Corina. Corina is asking you, how accurate is the albumin globulin ratio on a serum biochemistry panel as a blood test for FIP?
That's a very good question. Thank you, Karina. You specifically said on a blood test panel, if the cat is a suspect wet FIP, I would want to do the albumin to globulin ratio on the effusion rather than on the blood. In effusive FIP, what we have is a modified transudate. In other words, it's high in protein but low in cellularity. So if you have a total protein on the effusion of less than 35 grams per liter, that would be 3.5 grams per deciliter if you're in America and measure it that way. If it's less than 3.5, 35, then FIP is considerably less likely. The albumin globulin ratio on either blood or the effusion of over 0.8 pretty much rules out FIP. If it's less than 0.4, then FIP is quite possible, but you would want to look at the effusion itself, the cellularity, and if possible, send the effusion for RT-PCR. If you have a non-effusive case, and say you've got an albumin globulin ratio of between 0.4 and 0.6, look at the albumin, because albumin goes down slightly in FIP, but not hugely, whereas say the differential was something like ascending cholangiohepatitis, then you might have a very low albumin measure, and that will falsely, well, not falsely, but it will alter the albumin to globulin ratio.
Great response. That was great response, Diane. The next one is from Dr. Schechter. Dr. Schechter would like to ask you if there's any evidence of lymphedema, peripheral vascular disease, or venous insufficiency with feline coronavirus in your experience.
That's a very interesting question. That's taken perhaps from the what we're seeing with the COVID-19 patients. I have a cartoon on YouTube, and it will be going on to BitChute, of the pathogenesis of FIP, and it's in some ways quite similar to the pathogenesis of COVID-19. And what you would see in it is the infected monocytes, the coronavirus infecting the monocytes, and then adhering to the endothelial cells. And so that attracts an inflammatory response, which is what really causes FIP. The organs that are being served by the arteriole that is affected by the FIP granuloma may then be compromised to such an extent that the cat presents with clinical signs due to those lesions, the vascular lesions. So what we see tends not to be lymphedema exactly, but pyogranulomas of the blood vessel concerned, and it's rarely blood vessels going to the extremities. So we don't see swollen paws, for example. You're much more likely to see that in something like virulent systemic calicivirus infection, or of course of nephrotic syndrome of the cat, or perhaps congestive cardiac failure. But what we get is destruction of the blood vessels to the peritoneum, and that's why you get the leakage of fluid into the abdominal cavity, known as effusive FIP, or leakage of plasma, essentially, into the thoracic cavity, presenting as thoracic FIP, effusive FIP. And we also see hydrocephalus of the brain, which could be due to leakage of the vascular supply to the brain, the meningeal vessels. So it's not exactly like COVID-19 because the receptors are different. So in COVID-19, we're seeing predominantly problems related to the lungs because the ACE2 receptors are respiratory receptors.
Mm-hmm. Great. Diane, one last question before we resume the presentation. Joy is asking you, this references back to your first response, if RT-PCR services are not available near the practitioner, what is your next best recommendation to diagnose FIP? She says that what they have been doing is to sometimes judge based on the presence of the classical signs of FIP associated or accompanied with the positive F-CoV result to diagnose the cat as FIP positive. And then she has one quick follow-up, which is, what is your opinion on steroidal treatment of FIP? She doesn't differentiate that question between dry versus wet form.
The second one's really easy and quick to answer. No steroids, no steroids. And I've done a 180-degree U-turn. So if you're looking at my older publications, mea culpa, I've been saying use steroids. A couple of years ago, I realized that this wasn't a good idea, and I changed over to meloxicam. So I would only use it if it was just palliative. If you've given up on the cat, you're trying to make the cat eat and be more comfortable in the very last few days of life, sure, go ahead with the prednisolone. But if you really want to try to save the cat, then no, provided kidney function and blood pressure are adequate, then please use meloxicam instead, a non-steroidal anti-inflammatory. Even if you can't get meloxicam, a quarter of an aspirin every 2 to 3 days is also an anti-inflammatory, and it's cheap. But bear in mind the excretion of aspirin in the cat is very poor, so you mustn't give it more frequently than a couple of times a week. So if you didn't have access to RT-PCR testing, and I would like to mention that Glasgow University Veterinary Diagnostic Services do accept tests that are FedExed, samples rather, that are FedExed in from pretty much all over the world. So please do try to avail yourselves of that if you can. But if that really isn't an option, and you sound like you're using the coronavirus antibody test, then if you go through the FIP diagnosis algorithms step by step, you should be able to arrive at a really pretty good idea of diagnosis, whether or not it's FIP. There are a lot of arrows to the left saying, no, this isn't FIP. So you should be able to rule it out or rule it in using those steps very carefully. And as I mentioned, there are links in the notes to my videos guiding how I use them. In non-effusive FIP, I look in the eyes, I use an ophthalmoscope, and I'm not a very good ophthalmologist. So if I can spot changes, and I do, then you certainly can. Also, if you have just an ordinary, inexpensive light microscope, look at the effusion under the microscope. If there's an effusion there, look at that. If there are a lot of neutrophils, then you're dealing with the bacterial peritonitis or pleurisy. It's not FIP. So there are simple, inexpensive ways of arriving at a diagnosis. Using your own eyes, your own hands to palpate the abdomen, see is the mesenteric lymph node enlarged, and you can get there if you're a reasonably experienced, skilled clinician.
Great. Diane, wonderful responses. Let's get back to the presentation because I know you have a lot more stuff to share with us.
I'm afraid I do. So I wondered if we could prevent FIP by preventing infection with coronavirus infection. If we could prevent FIP by preventing coronavirus. Coronavirus is shed in the feces and can last up to 7 weeks in the environment of a cat litter tray because it's protected by the protein of the feces and by some cat litters, and we'll talk about that in a moment. I should also just mention that coronavirus, because of the spikes being protein and lipid, the spikes are really quite fragile. So coronavirus that is shed outdoors, it lasts only minutes to hours, just as human coronavirus shed outdoors in the sun will rapidly be inactivated. Coronavirus transmission is fecal oral and mainly indirect. So a cat shares a litter tray with an infected cat and then grooms their paws and becomes infected. I wondered, could we prevent coronavirus infection at the level of the litter tray? And last year we published a paper about the effect of cat litters on coronavirus infection in the laboratory on cell culture and also in cats. And what we found was that Fuller's Earth-based, bentonite-based cat litters abrogated infection of cell culture. We worked with 2 very large multi-cat households in Denmark using only the best cat litters, i.e. Fuller's Earth-based cat litters. And we found that Dr. Elsie Catatrack cat litter reduced but didn't completely abrogate coronavirus transmission. So you can use it to reduce the amount of infection, but not to completely get rid of it. We were dealing with incredibly large households, each of over 20 cats. If you can't get this kind of cat litter, which is probably only available in America, what we're looking for is lack of tracking. So you want a clumping cat litter and for it to be Fuller's Earth based. And we think that the Fuller's Earth binds the virus in some way. So we then wondered, could coronavirus transmission be prevented by stopping virus shedding? So intervening at an even earlier stage. And my colleague Cheryl Curran, in her own ragdoll breeding category, she'd been trying various antivirals to see if she could stop coronavirus shedding. And I know that a number of cat breeders and rescuers have been trying various antivirals to see if they could get rid of coronavirus amongst their cats. And Cheryl got in touch with me very excited because she'd found that Mutian pills stopped coronavirus shedding. And these are the results at 2 mg per kilogram doses. So we started with a lower dose. And what we're seeing here on the graph is on the y-axis, that is the vertical axis, the coronavirus RT-PCR CT. CT stands for cycle threshold. And the CT is counterintuitive in that the lower the CT, the more virus there is. And along the x-axis is the time in days. And you can see that each of these lines corresponds to a different cat with different test time points. And there's the control period, and then at day 0, they received the short course of Mutian. And that most of the cats stopped shedding virus, but one of them didn't stop shedding virus, and she was in a small group with cat C6 in the red lines and dots, and reinfected cat C6. So after that time, we increased the dose to 4 milligrams per kilogram, and that cleared the virus in all the cats. You can see cat C6 being redosed and stopping shedding virus. And in our publication, we reported on 29 cats in 5 households, which totaled altogether 50 cats, and eradicating coronavirus from those households. Mutian comes in 3 sizes, Mutian 200, 100, and 50. From our study, we learned some things. First, it's essential to do a post-treatment fecal RT-PCR test to ensure that all of the cats are fully negative. Otherwise, a single missed cat will reinfect all of the other cats. Second, make sure that the fecal samples do not have cat litter on them, because that can inhibit the PCR test. As we've already seen, bentonite-based cat litters bind the virus. And third, use a laboratory that reports virus quantity if you can, and controls for fecal inhibitors. That last is very important, and not all laboratories do that. So again, because we're doing screening, it's essential that we have an RT-PCR test that is sensitive. Does stopping coronavirus shedding prevent a cat from developing FIP? Well, that's something that we don't know. We're following the coronavirus antibody titers, when available, of the study cats to establish the answer to this question. And just interestingly, as an aside, something we can learn from the doctors is that countries that use hydroxychloroquine for malaria prevention have fewer cases of COVID-19. And for those of you who are unfamiliar with my style, my references are at the bottom of the page, but you will also see them in the notes if you're wanting to follow up to confirm anything that I'm saying. So a reducing coronavirus antibody titer indicates that there's no more virus in the body. And this is a useful thing to confirm that the cat really has recovered from coronavirus. We need a significantly reducing coronavirus antibody titer as evidence of recovery from FIP, i.e. there will be variation, laboratory variation in tests from one test to another very often. So I'd like to briefly tell you about Basil, who's a bit of an internet celebrity. He recovered from wet FIP, and there are 3 other British short-hair cats in his household, Bentley, Ashley, and Natasha. And they were treated to stop them shedding coronavirus. Basil was kept isolated from them initially to stop infecting them, but then we did the coronavirus PCR on their feces and found that they were all shedding virus. So they got treated to stop reinfecting him once he'd recovered from FIP. And in this graph, I show the antibody titers of these 4 cats in this one household. And you can see that they all started with very high titers of 1/280 or greater. At the Veterinary Diagnostic Services Laboratory in Glasgow, we stop diluting the samples at 1/280, and we report them either as 1/280 or above 1/280 if they're still fluorescing very, very brightly at that level. So Basil probably had a coronavirus antibody titer in the tens of thousands. So in repeat tests, we're not seeing his level go down. He's the blue line going straight along at the top. But can I draw your attention to a cat called Ashley, who has the green line and the little triangles, and you can see that over a 10-month period, Ashley's coronavirus titer decreased from 1/280 through 640, 320, 160 to 80, and that is a significant fall in antibody levels, and that gives us confidence that Ashley no longer has virus in her body. You can see that all 3 of the in-contact cats have falling antibody titers. Now, it wouldn't be ethical for me to request that the people in my study deliberately bleed the cats for research purposes. So what we say is, if the cat is being bled for some reason, some health reason, and you have leftover blood, can we have it for coronavirus antibody testing? So gradually we're getting a little trickle of those results coming in. And here are all these cats happily mixing together again. It was safe to mix them again. We now have 10 households of cats that have where Mutian has been used to stop the cat shedding virus. So you can see that we now have 91 cats that have been treated. And the main reason is the same as it was for Basil's household. It's to prevent reinfection of an FIP cat who is recovering. In 2 households, the reason was because they had coronavirus-associated diarrhea, so they were treated with Mutian and made a nice recovery. And in 2 more households, they were breeding households, and here you can see a nice litter of British short-haired cats born after a household has eradicated coronavirus infection. And I'm getting feedback from the breeders that the kittens are just so different from when they had endemic coronavirus infection. You can see that these kittens are of nice even sizes, whereas coronavirus infected litters tend to be runty. And this is Cheryl's first litter, born after she had become coronavirus negative. They were all negative as well, not shedding coronavirus, not infected. But Cheryl was worried what would happen to them when they go out into the world, into their new homes. So she got a special import license. She's based in the UK and brought in Felocell FIP, the FIP vaccine, which can only be given at 6 weeks of age. That's why the kittens have to be kept coronavirus free until they're 16 weeks of age, or else the vaccine won't work. I don't have time to talk in detail about the FIP vaccine, but I do have a video on it that you can watch. It's called The Truth About the FIP Vaccine. Felocell FIP is an intranasal vaccine, a temperature-sensitive mutant that only replicates in the cooler nares. Actually, this is not a photo of Felocell being given, but one of a Bordetella vaccine being given intranasally. But on the right, you can see a thermal image of a cat's head showing the cooler nares. Now, what I wanted to mention to you was that previous FIP vaccine attempts had all failed because they resulted in antibody-dependent enhancement and early death syndrome. And that's really very worrying in the context the present pandemic, because there are similarities between human and cat coronaviruses. At present, prevention is by prevention of the disease is by trying to avoid infection, and other strategies include stopping virus shedding using drugs, i.e. Mutian or chloroquine, in cats and humans respectively. And as I've mentioned just now, the fellow cell FIP vaccine is used to stop FIP developing, and vaccination is being hugely promoted for SARS-CoV-2. But because of the similarities of pathogenesis of these diseases, in other words, they're immune-mediated diseases, rather than simply diseases of the virus causing cytopathic effect, that could be very dangerous. So safety, there are safety concerns. In both conditions, the mortality is in animals and humans that are in multi-cat, multi-human environments. In other words, breeders, cat breeders, shelters, boarding catteries also, and in old folks' homes. So they're both conditions of immunosuppressed individuals. In other words, because kittens are very young, their immune systems aren't fully developed, and also they're stressed by a lot of concurrent stresses, such as being rehomed, being neutered, being vaccinated, and the humans can have comorbidities. In both coronaviruses, death is due to immune-mediated pathology. Here on the left, we have the lungs of a SARS-CoV-2 patient, and the reference is at the bottom. And on the right is a postmortem that I did of a thoracic FIP patient. And in both, you can see the fibrinogen plaques on the lung surfaces, and in the cat also inside the pleural cavity on the pleurae. Mencheri et al. Published a paper in Nature Medicine in 2015, where they made a chimeric virus with coronavirus spike. They used the SARS virus, and they put in a receptor they put in genetic code that would attach to human angiotensin converting enzyme receptors in the human respiratory system. And they importantly said both monoclonal antibody and vaccine approaches failed to neutralize and protect from infection with coronaviruses using the novel spike protein. So I think we need to pay very close attention to this, because this is similar to the attempts to make FIP vaccines using spike proteins. And not only did they fail to protect, but in cats they made matters a lot worse. And there are a lot of papers by scientists who have tried to make vaccines to the first SARS coronavirus 1 virus that emerged some years ago, or to the MERS coronavirus. So to go back just a moment to Cheryl, the ragdoll breeder, she coronavirus antibody tests along with her FIV annual check. Key message here is to coronavirus antibody test kittens or cats prior to introduction into a household to prevent coronavirus introduction. And I've got a cartoon video of this that you can perhaps show in your waiting rooms. It's on YouTube. And I've written a blog about it on the Biogal website. My main point being that introducing a pedigree kitten who has not been tested for coronavirus antibodies to your existing cats is playing Russian roulette with their lives. And similarly, cats and kittens from rescue shelters, anything that's infected with coronavirus, it could endanger your existing cats. And this sort of quarantining has been done on a country level with the Falkland Islands, where the vets realized that the cats of the Falkland Islands were all coronavirus negative, and now insist on negative coronavirus antibody certification for coming in to that country. So again, because you're screening, you want to have a sensitive test because you do not want false negative results. And I'd like to just briefly finish with an appeal. Please contact David Lee, who's a veterinary student, if you would be willing to share your practice records regarding vaccination and FIP. And his email is in the notes as well. We're looking at what vaccines might trigger FIP. In other words, we want to investigate the effect of stress on FIP development. For more information, visit my website, catvirus.com. For reliable information on SARS-CoV-2, go to the YouTube channel of Dr. Mike Hansen. And a big thank you. I'm blushing because my husband's sitting beside me. Many thanks to Len, Yotam, and to Dr. An for organizing, sponsoring, and chairing this webinar, and also to our friend Bertrand, who allowed me to use his office with a better internet supply than we have at home. A huge thanks especially to cat guardians who have allowed their cat stories and their samples and the results to be used for my research and for these stories, and to the vets, to yourselves. I couldn't do what I do without veterinary surgeons in the field sending me samples and cases. And a huge thanks to the CatVirus donors and subscribers who fund my research.
All right, this has been a truly spectacular presentation. Diane, there is no hope of answering all these questions. You have triggered an avalanche of questions, and our commitment to the audience members, who are, by the way, raving about your presentation, is that we will follow up with each of them. But I think we have time to provide one answer or one question. This is actually from a friend of mine, Dr. Sally Haddock in New York City. She was wondering if you could clarify the 1/4 of an aspirin dose that you mentioned earlier in the presentation. Sally is asking, is it a 1/4 of a normal aspirin every 2 to 3 days, or of an 81 milligram low dose aspirin tablet?
That's a really good question. Thank you very much, Sally. Obviously, if it's a kitten that's being treated, and some of these cats with FIP are very, very underweight, so the low dose one, if that's available. I was thinking about a cat of 4 to 5 kilograms normal size, and the 300 milligram tablet, which a quarter would mean 70 milligrams, but clearly for a much smaller cat, you would want to go with a much lower dose. However, that would absolutely be my last resort if you couldn't use meloxicam, and also things like Verbigen Omega, the feline interferon.
And in closing, Diane, I just wanted to read one comment here from Jessica Cannon, which seems to capture the comments from about 50 of the people who have written in. She writes, "Excellent presentation. Thank you, Dr. Addie." So despite the technical glitches we had with the microphone, you really delivered a very powerful presentation. We thank you for the great job that you did. And for our global audience, thank you so much for joining us for this special Biogal webinar. We look forward to having many more in the future.
Thank you all very much for attending, and thank you, Arnold, for being such a gracious and thorough host.
Great. Take care, everyone.